Hi, I'm Frances Shefter with Shefter Law PA, where we help families have a stress-free IEP experience. The other day, I asked in one of my Facebook groups for topics of what parents want to know about, parents with children with different abilities. And one of the questions that came up is how a child qualifies for OHI or other health impaired, and how that's different between a 504 plan and an actual just health plan, and what that means for your child. So OHI, other health impaired, is when your child has a disability that is a diagnosed disability, like ADHD is one of the biggest things that come in other health impaired. Now with ADHD, you can actually qualify for an IEP, a 504 plan, or just a regular health plan. What's the difference? So a health plan is just that your child might need to take medication during school. So it's done by the doctor, and the doctor gives the nurse instructions of what needs to be done and how it needs to be given, at what time, and if there's anything else that needs to be monitored with the medication. A 504 plan is when your child needs some accommodations, like frequent breaks or extra time. Those are the basic accommodations. To qualify for a 504 plan, you just need a disability, a diagnosed disability. So it could be ADHD, it could be hearing impaired, it could be visually impaired, it could be almost any medical diagnosis that requires you to have accommodations to be successful in school. IEPs are the step farther, is that your disability is now impacting your child's ability to progress in the general education curriculum. So your child needs some specific instruction in the certain areas that their child is having issues. So because of the ADHD and needing the extra time and needing frequent breaks and so forth, your child might need also reminder to be taught how to use a checklist to make sure all the assignments are done, because if they're constantly taking breaks, they might forget how to come back. So they need to be taught that directly. They might need to have their assignments broken down or chunked. They might need the direct instruction in math, the specific little areas to catch your child up to be able to access the general education curriculum. So that's the three differences. A little bit hard to understand the health plans, 504 and IEP qualifications. 504 and IEP qualifications, everybody has difficulty with it and never knows. Some people say, that you can qualify for both, but you can. If you're not sure and you're confused, please feel free to call my office. The information's at the end of the video. And again, I'm Frances Shefter with Shefter Law PA, where we help families have a stress-free IEP experience.